Hello, I'm here to raise awareness on SIDS. What is SIDS? What causes SIDS and who is affected? I'm here to educate the community on what SIDS is to lower the risk of such a tragedy happening to your family. First off, I'd like to introduce myself. My name is April. I'm a survivor of SIDS. In June of 2001, I lost my son to the silent killer. And I was not educated. In fact, I knew nothing about what it was or any risk factors. Losing my little angel to SIDS made me want to teach people what the silent killer was and educate on the risk of SIDS. Knowing what it is will not stop it from happening, but knowing the risk factors that put your baby at a greater risk can reduce the risk of it happening to your family. My son was only 6 weeks old and was a premature baby when he was born. He was sick at birth and had to be placed in the neonatal care unit. This put him at a higher risk, as I know now. The death of a child is the hardest thing to go through, but it has made me want to get the word out. Knowing what SIDS is and some facts about it and what are the risk factors would help people be more aware of the silent killer SIDS. First, I will begin by explaining what the silent killer is. What is SIDS? SIDS is the leading cause of death in infants ages 1 month to 1 year. This was found at Safe to Sleep. Most deaths occur age 1 to 4 months. Most occur by age 6 months, but it can occur all the way until they reach the age of 1 year. SIDS is sometimes called crib death because it is happening when they are sleeping, but in fact, it has nothing to do with the crib. SIDS is a sudden, silent medical disorder that can happen to an infant who seems readily healthy. A full medical exam will be done after the death has occurred and determine the manner of death. This was found at Safe to Sleep and What is SIDS? You will be asked a million questions, and some that seem like they are irrelevant. At the end, it makes you feel like you are the one being blamed. This was from my personal experience. Now that you know what SIDS is, I'll discuss facts about SIDS and what causes it. What are some facts about SIDS and what causes it? More than 2,000 babies died from SIDS in 2010. This is the last year of the statistics that were found at Facts About SIDS. Among the babies, more boys seem to die from SIDS than do girls. SIDS deaths increase in colder months than they do in warmer months. African American babies have a 2 times greater risk of dying from SIDS. The cause of SIDS is still unknown, but they are trying to find out more about the silent killer. More evidence suggests that infants who die from SIDS are born with brain abnormalities which shut their brain down and cause them not to breathe. Scientists believe that brain defects alone are not enough to cause SIDS death. I am now going to discuss who is most likely affected and the risk factors of SIDS. Although sudden infant death can strike any infant, researchers identified several factors that can increase the risk of SIDS. This was found from the Mayo Clinic. Risk factors include sex. Boys are more likely to die from SIDS than do girls. Age. Infants aged 1 to 3 months are more vulnerable. Race. For reasons not understood, Black, American Indian, or Eskimo infants are more likely to develop SIDS. Family history has a greater risk. If there is a family history, it will make the risk even greater. Secondhand smoke. Babies who live with smokers are at a greater risk of dying from SIDS. Being premature. Being early and having low birth weight increases the risk of SIDS. There are some maternal risk factors which also can increase the risk of SIDS. The mother is younger than 20. She smokes cigarettes, uses drugs or alcohol during her pregnancy, or has inadequate prenatal care. Now to conclude my speech about SIDS. Now that you know what SIDS is, maybe you, too, can educate others and get the word out that SIDS is real. Knowing the risk factors and causes, and even knowing that there is a silent killer, SIDS, maybe this could reduce the risk of it happening to you. While SIDS is #1 cause of death in infants, but like myself, I did not know until it was too late and it happened to me. This was the worst thing that ever happened to me, and I want to raise awareness and try to lower the risk of it happening to others. Found out on statistics, 45% of all infants die from sudden infant death. 24% die from accidental suffocation and strangulation in the bed. 31% die from unknown causes. So out of 100% of babies, 45% die from SIDS. If we can reduce the risk, then let's do it.